Shepherd.
One word, called out by a combat soldier who hadn't seen her face in 3 years, across a room full of blood and broken glass, where Tessa Merrick, float nurse, and nobody had just driven a needle into a dying man's chest and pulled him back from the edge. The soldier knew exactly who she was. Her supervising doctor didn't. For 4 months, he had dismissed every warning she raised, overruled every call she made, and reminded her more than once to stay in her place. She had tried. Until one explosion one night and one patient too critical to ignore forced her to stop. She had saved lives, and that might cost her everything she had spent 3 years protecting. If stories like this are the kind that stay with you, hit subscribe. There's more where this came from, and you won't want to miss what's next. The overnight shift at St. Catherine's Community Clinic started the same way it always did, short-staffed, underfunded, and held together by people who had learned to stop expecting things to get better. Tessa Merrick had worked 4 months at this clinic and still didn't have a permanent assignment. She floated between departments, filled whatever gap opened up, and disappeared before anyone thought to learn her name. That was the arrangement she preferred. A float nurse went where she was pointed, did what was needed, and left no impression. Tessa had spent 3 years building a life designed around that principle, and St. Catherine's, nestled in a South Side neighborhood that most of the city had quietly given up on, was as good a place as any to disappear into. She arrived at 6 in the morning with a carry cup of gas station coffee and a patient assignment sheet that had already been revised twice. The waiting room held a man with a wrapped hand, 2 children running fevers, and an elderly woman asleep in the corner chair with a rosary wound between her fingers. Tessa moved through the space the way she moved through everything efficiently, without drawing attention, cataloging details out of habit, and saying nothing about what she noticed. The clinic's supervising physician, Dr. Graham Denning, was already there when she arrived. He'd been running this place for over 30 years, and everyone on staff knew it because he reminded them regularly. He wasn't a bad man. Tessa had figured that out within her first week. He'd built St. Catherine's from a converted storage room into a functioning clinic, stayed through funding cuts and staff walkouts, and neighborhood violence that scared off everyone else. He knew the names of patients whose charts dated back 2 decades. He'd once delayed his own vacation to cover a colleague's emergency surgery schedule without telling anyone. There was real care underneath the authority, and in another context it might have been admirable. But 30 years of being right, or at least of having no one with enough standing to tell him when he was wrong, had calcified something in him. He didn't consult. He decided. And the longer that went unchallenged, the more certain he became that the deciding was his alone to do. He rarely called Tessa by her name. She was usually the float, or one of the nurses delivered over his shoulder as he moved from room to room with the unhurried certainty of someone who had never been seriously questioned. Walter Keene was in room 4. He was 67 years old, admitted 2 days earlier for what had been logged as a respiratory complaint, a persistent cough, some fatigue, a low-grade fever. He had the kind of face that made you think of grandfathers at baseball games, weathered, soft-eyed, a little amused by everything, even when he was uncomfortable. Tessa checked his vitals at 7:15 and wrote them down without comment, then checked them again at 8 and again at 8:40. The numbers were moving in a direction that made something go quiet in the back of her mind, not alarm exactly, but the particular stillness that came before alarm, the moment where the body recognized a pattern before the brain had finished processing it. His blood pressure had dropped 11 points over 90 minutes. His heart rate was climbing in small increments. When she pressed 2 fingers against the inside of his wrist, the pulse was there, but thin, retreating. She lifted the edge of his blanket and looked at his hands. The fingertips were beginning to shade toward blue at the edges, a dusky discoloration that didn't belong there. She documented everything in the chart, flagged it with a clinical note, requesting a sepsis evaluation, and went to find Dr. Denning. He was at the nursing station, reviewing discharge paperwork, reading glasses low on his nose. Tessa set the chart in front of him and walked him through what she'd observed: the pressure trend, the compensatory tachycardia, the peripheral circulation change. She recommended opening an IV line, drawing blood cultures, ordering a lactate level, and initiating the sepsis protocol. She kept her voice measured, factual, and brief, the way she'd been trained to deliver field assessments. Denning listened with the expression of someone waiting for a point that never came. He picked up the chart, glanced at it, and set it back down. He said he'd been treating Walter Keene for 7 years, that Walter had a history of respiratory issues and anxiety-driven blood pressure fluctuation, and that the pattern she was describing was consistent with his baseline. He said it not unkindly, but with the particular finality of a man who considered the conversation over. He reminded her that he appreciated her attention to detail, but that clinical assessments were his domain. He asked her to return to her other patients. Tessa took the chart back. She wanted to say the peripheral cyanosis is not a baseline variation. She wanted to say lactate levels don't lie. She said neither of those things. She was a float nurse. She had no admitting privileges, no prescribing authority, and no standing to escalate over his head without triggering a process that would take longer than Walter Keene had. She returned to room 4, checked Walter's temperature. It had climbed another ½ degree, squeezed his hand once, when he looked up at her with those mild, puzzled eyes, and walked back into the hallway. She was documenting her last vitals entry when the building moved. It wasn't a sound. First, it was pressure. A compression in the air that she felt in her sternum before her ears registered the noise. The windows at the end of the hallway flexed inward, held, and then the sound arrived, a low, concussive boom that rolled through the walls like something geological. The overhead lights flickered. A tray cart near the supply room rolled 2 feet on its own. From outside, almost immediately, came the second-hand roar of a structure failing, materials separating from other materials, the particular mechanical chaos of a building that had stopped being a building. Tessa walked to the window. A column of black smoke was rising from the direction of Aldine Street, maybe 4 blocks northeast, in a residential zone she knew held a mix of apartment buildings and older row houses. She stood at the glass for exactly 4 seconds, counting sirens as they started 1, 2, 4, 6, overlapping and calculating the distance between the smoke and the clinic's front door. St. Catherine's was the closest medical facility to that block by at least 1.5 miles. She went directly to Dr. Denning. He was already at the window in his office, looking at the smoke with an expression that mixed concern with caution. She told him they needed to initiate the mass casualty protocol, pull the emergency supply carts clear, and designate the waiting room assign roles before the first patients arrived. He looked at her the way he always did when she moved faster than he was ready to move. He said they didn't know the scale of the incident yet. He said the ER at Mercy General would likely absorb the majority of cases. He said they should wait and assess as patients came in. Tessa understood then that she had reached the end of asking. She didn't argue. She didn't explain what she was doing or why. She simply turned and walked to the supply corridor, pulled the emergency cart into the hallway, and started moving. She stripped the waiting room of its magazine racks and pushed the chairs into 3 distinct clusters, one near the entrance for triage intake, one against the left wall for patients who could wait, one near the back hallway door for immediate cases. She found the trauma supply cabinet, unlocked it with the key code that was the same as every other cabinet in the building, and began staging IV kits, oxygen equipment, hemostatic dressings, and airways along the windowsill. Marlene Foster, the senior floor nurse, came around the corner and stopped. She had been at St. Catherine's for 11 years and had seen residents come through with more confidence than competence. But she had never watched a float nurse commandeer the waiting room with this kind of deliberate economy. She didn't ask what Tessa was doing. She started helping. Taryn Brooks, one of the medical technicians, 23 years old, and 6 months into her first real job, appeared in the doorway and looked at the room, then at Tessa. Tessa told her when patients come in, write the vitals directly on their skin with a marker if there's no time for a form. Triage color goes on their left wrist, red, yellow, or green. Red means they go to the back hallway immediately. Yellow means they wait on the left wall. Green means chairs by the window. She demonstrated the marking system on her own forearm. Taryn nodded and went to find a marker. Tessa had just finished positioning the last oxygen concentrator when the front door opened and the first patient came through, a man in his 40s, with the left side of his face burned from his hairline to his jaw, held upright by a teenage boy who couldn't stop repeating that they'd been on the sidewalk. They'd just been on the sidewalk. Tessa moved to them, got her hands on the burned man's face without flinching, checked his airway, checked his eyes, and put a yellow mark on his wrist. She told the boy which chair to bring him to, what to say if the man lost consciousness, and to come get her before anything changed. She was already turning toward the door when the next group arrived. 3 people came in together. A woman with a piece of glass still embedded in her forearm. A man holding his collarbone with the rigid self-consciousness of someone trying not to move a broken thing. And an older gentleman in a dust-covered jacket who kept saying he was fine. He just needed to sit down, as if saying it enough times would make it true. Tessa moved through all 3 of them in under 90 seconds. Green, yellow. Red, the old man's breathing was shallow, and his lips were pale, and she didn't care what he said about being fine. Behind her, she heard Denning's voice from the hallway, raised slightly, not angry, but surprised, the voice of someone arriving at a scene they hadn't authorized. She didn't look back. There wasn't time to look back, and she knew in the part of herself that she had spent 3 years trying to muffle that looking back was never what the situation required. The waiting room was becoming a triage bay. The people moving through it were beginning to follow a system. Marlene was moving with her, now reading the color marks and routing patients without being told twice. Taryn was at the intake point with her marker uncapped, meeting each new arrival with a steady voice that surprised even her. And Tessa Merrick, who had come to this clinic to be no one, was doing the thing she had promised herself she would never do again. She was running the room. She had told herself after Syria, after the debriefing and the paperwork and the ceremony, where someone pinned something to her chest, while she stood perfectly still and felt nothing, that she was done being the person who made the calls. She had been wrong, or maybe right, or maybe both things at once, in the way that grief rarely resolves into anything clean. But she had built a life on that promise to herself. And now, with the sirens getting louder outside, that life was already changing shape around her. Outside, more people were coming. The next 40 minutes moved the way bad situations always did, faster than preparation allowed, and slower than mercy should have permitted. Patients came in waves, a group of 5, then 2, then a family of 4, where only the father could walk on his own. The room that Tessa had reorganized held its shape because she kept moving through it, adjusting, redirecting, making the small corrections that kept a system from collapsing into a crowd. Marlene worked alongside her without needing to be told twice about anything. Taryn had stopped looking frightened and started looking focused, which was all Tessa had asked of her. Dr. Denning moved through the space too, but differently. He was a physician of genuine ability in the context he'd built for himself, a clinic that saw 30 patients on a busy day, where he set the pace and the protocol and the tone. What surrounded him now was not that clinic. It was something closer to a field station, and the rhythms were wrong for him. Tessa caught a glimpse of him standing at the edge of the intake area, chart in hand, watching the flow of patients with an expression she hadn't seen on him before. Not arrogance, not authority. Something quieter and harder to look at a man who had spent 3 decades being the most capable person in any room he entered, standing in a room that had outpaced him. She turned back to her patients. There was no time for anything else, and whatever she might have felt about it had no useful place to go right now. The man in the yellow zone near the left wall was the one who changed everything. He'd been brought in by 2 strangers who found him on the sidewalk outside the collapse zone mid-50s, heavy-set with blast particulates still visible on his jacket and forearms. Tessa had triaged him yellow 12 minutes earlier, stable enough to wait, not critical enough for immediate intervention. But when she looped back to check him, the picture had changed. His breathing had become labored in the specific way that is less about effort and more about obstruction, like a man trying to draw air through a narrowing passage. His pulse was rapid and weakening. When she looked at his chest, the left side wasn't moving the way the right side was. She put 2 fingers at the base of his throat and felt the trachea shifted slightly to the right. She looked at his neck veins distended above the collar. She needed 3 seconds to know what she was looking at, and 3 more to know that he had perhaps 4 minutes before his heart gave out from the pressure. Tessa called for Dr. Denning by name loud enough to carry across the room. He was there in under a minute, which was the fastest she'd seen him move all morning. She walked him through the presentation as concisely as she could, tracheal deviation, absent breath sounds. On the left, distended neck veins, compensatory hypotension. Tension pneumothorax. She told him they needed to needle decompress the left chest. Second intercostal space, mid-clavicular line immediately, and she was already reaching for the 14-gauge angiocath in the trauma kit when Denning put his hand out and stopped her. He said she was not a physician. He said the procedure she was describing was outside the scope of nursing practice. He said it with the same final authority he used for everything, the voice that had worked for 30 years, because no one had ever been standing in front of a dying man when he used it. Tessa looked at the patient. The man's lips were beginning to blue. She looked at Denning and said very quietly that he could perform the procedure right now, or he could move aside, but she was not going to wait while this man's heart stopped. She didn't raise her voice. She didn't repeat herself. She held the catheter and waited. The longest moment in the room was the one that followed. Then Denning stepped back. Tessa located the landmark by feel-second rib space above it, mid-clavicular, and advanced the needle. The rush of air that escaped was immediate and audible, a small hiss that meant the pressure had somewhere to go now. The man's chest rose on both sides for the first time since he'd arrived. His oxygen saturation, which Taryn had been tracking on the portable monitor, began climbing back from the low 80s toward something survivable. He didn't open his eyes, but the color came back to his face in slow degrees like a tide returning. Tessa stepped back and stripped off her gloves. She was already moving to the next patient. The girl came in through the front door, held between 2 women who were both crying, which meant neither of them was the one who needed the most attention. The girl was young, 8, maybe 9, and she was not crying. She was very still in the particular way that children become still when they have moved past the threshold of ordinary pain into something their nervous system doesn't have a category for. Her name, one of the women managed to say, was Sienna. A piece of structural material had gone through the wall of the apartment when the building came apart, and Sienna had been standing on the wrong side of it. Tessa got her onto the floor of the back hallway, the only flat surface available, and cut away the lower section of the girl's shirt. The wound was in the left lower quadrant, a puncture wound with the entry tract still partially visible, bleeding steadily and deep. Tessa opened a hemostatic dressing from the trauma kit, packed the wound with the controlled pressure she'd been taught, in a context no one in this building knew about, and held it. She felt the bleeding slow beneath her hands. Sienna was watching her. The girl's eyes were open and tracking, and she had one hand pressed flat against the floor beside her, as though anchoring herself to something solid. Then Sienna spoke, her voice thin but coherent, a child trying to sound like someone who wasn't frightened. "Does it hurt you?" Sienna asked. "What you're doing?" Tessa's hands didn't move. The question landed in a part of her that she'd stopped paying attention to, which made it louder than it should have been. No one at this clinic, not in 4 months, had asked her anything about herself. She looked at Sienna directly and kept her voice steady and warm. She said no. She said Sienna just needed to keep her eyes on her right here, and everything else could wait. Sienna held her gaze. Her hand stopped pressing against the floor quite so hard. Tessa held the dressing until a gurney was ready to transport, then directed the handoff herself, specifying the wound location, the packing method, and the estimated blood loss to the paramedic taking over. She watched the gurney move toward the door. She turned around and found 3 men she didn't recognize standing near the entrance. They were in civilian clothes, but the way they stood gave them away immediately. Weight distributed evenly, hands, loose, eyes already moving through the room in the pattern of people trained to assess environments rather than simply occupy them. One of them was already reading the triage layout, following the color system, tracking the patient flow. He moved through it the way you only moved through something if you recognized the logic behind it. He was perhaps 40, with close-cropped hair going silver at the temples, and the kind of stillness that had nothing to do with calm and everything to do with training. His name was Julian Serrano, though Tessa didn't know that yet. She knew his face in the way you knew things that had been buried, not immediately, not cleanly, but as a sensation before a thought, something in the chest, tightening before the mind finished its work. Julian's eyes moved across the room and stopped on her. He had served alongside the 38th Rescue Squadron more than once as a joint force operator, and he knew exactly what kind of person set up a triage bay that looked like this one. The color-coded zones, the supply, staging, the patient flow management, no civilian clinic staff designed a system this way without having learned it somewhere that demanded it. He had not expected to find her here. He had not expected to find her at all. He said one word across the room. "Shepard." Tessa went very still. The room continued around her, Marlene redirecting a new arrival, Taryn recording vitals, someone crying near the entrance, the low mechanical noise of the oxygen concentrator. All of it kept moving. Only Tessa had stopped the way a person stopped when something they'd been running from turned out to be standing in the same room. She hadn't heard that name in 3 years. It belonged to someone she'd spent a considerable amount of effort dismantling piece by piece until what remained was a float nurse with a gas station coffee habit and a schedule that kept her moving too fast to stay in one place long enough to think. Before she could respond, the situation moved past her. A vehicle pulled up outside military from the sound of it, and a woman in uniform entered the clinic with the bearing of someone who hadn't needed to announce herself in a long time. Lieutenant Colonel Audrey Kincaid stood at the entrance of the waiting room and took in the triage system in 10 seconds of unbroken attention. Then she asked, to no one in particular, who had set this up. Tessa said she had. Kincaid looked at Julian. The question she asked was short and direct. Julian answered it the same way. He gave Tessa's name, her former rank, her unit. Staff Sergeant Tessa Merrick, 38th Rescue Squadron, Pararescue. He gave the call sign Last Shepherd, the way you'd give the most important piece of information in a briefing, not for effect, but because it was the thing that made everything else make sense. Dr. Celeste Rowan, the military physician who had come in with Julian's group, had been moving through the patient zones since she arrived, checking the work that had already been done. She confirmed what she'd found. The needle decompression had been performed correctly, landmark and angle both right. The hemostatic packing on the abdominal wound had been applied with precision. The triage classification system was adapted from combat casualty care protocols modified intelligently for the available resources. Kincaid asked Julian for the service record. He pulled it from his phone: 3 combat deployments, a Purple Heart, an Air Medal with Valor, a Commendation Medal, 11 confirmed saves in the final mission alone under direct fire. Kincaid read it without expression. The room was quiet in a way it hadn't been since the first patients arrived. The people who'd heard Marlene Taryn, 2 paramedics near the door, were looking at Tessa with the particular expression of people revising a story they thought they already knew. Dr. Denning had heard all of it. He stood near the nursing station with the chart he'd been holding when Kincaid arrived, and his face had moved through something complicated that settled into something harder to name than simple surprise. He looked at what Tessa had done today, the procedures, the triage, the decisions, and raised the question of scope. He said it carefully, not cruelly. A nurse, regardless of her background, had performed a needle thoracostomy and managed a penetrating abdominal wound without physician authorization. He said this created liability. He said it mattered legally and professionally what had been done here and who had authorized it. Tessa listened. She didn't argue. She stood in the room she had reorganized, surrounded by patients she had stabilized, wearing gloves that still had someone else's blood on them, and she said nothing. Because the larger truth that the man with the tension pneumothorax was breathing, and Sienna Carter was on her way to surgery instead of dying on a hallway floor, was not something that fit neatly inside the framework he was describing. She had known when she picked up that catheter that it might come to this. She had done it anyway. The anonymity she'd built over 3 years was gone. The name she'd buried was in the air, and she didn't know yet whether that was the worst thing that could have happened or the only thing that was ever going to save her. Kincaid let Denning finish before she responded. She stood with her hands loose at her sides and let him complete the full arc of his concern liability scope authorization, delivered with the careful precision of a man who knew he was standing on complicated ground. When he finished, she gave him a moment of quiet that was not agreement, and then she asked him a question. She asked what would have happened to the man in the yellow zone if Tessa had waited for a physician to authorize the procedure. Denning said that was a hypothetical. Kincaid said, "It wasn't." Dr. Rowan had reviewed the case presentation tension pneumothorax at that stage of progression, with the hemodynamic compromise already present. Left a window for successful intervention of somewhere between 3 and 5 minutes from the point Tessa identified the condition. Kincaid asked Denning where he had been when Tessa called for him, how long it had taken him to arrive, and how much longer it would have taken to prepare and execute the procedure himself. She wasn't asking to humiliate him. She was asking because the numbers mattered, and because Denning was a precise man who understood numbers, and because she wanted him to do the math himself rather than hear her do it for him. Rowan added that the hemostatic packing on Sienna Carter's wound had maintained its position through transport, which was not guaranteed with improvised field applications, and was the difference in penetrating abdominal injuries between a child arriving at surgery with viable vitals or not. Then Rowan said something that made the room go quieter still. She had just received word from the receiving hospital. Sienna was out of the initial surgical assessment. The wound packing had held. She was stable, and the surgical team expected a full recovery. The relief in the room was visible. Taryn exhaled sharply. Marlene closed her eyes for 1 second. Even Denning's posture shifted, some held tension releasing without his permission. Kincaid looked at Denning and said that what he was describing as a liability was by any clinical measure the reason those people were still alive to generate paperwork. She said she understood the regulatory concern. She said it was real and she wasn't dismissing it. but she asked him to separate two things that were not the same: the question of what the rules permitted and the question of what the situation required. She said those two things had been in conflict all morning, and only one of them had saved anyone's life. Denning didn't answer immediately. He set down the chart he'd been holding and looked at the room. The triage lanes still marked the color tape still on the wall. The waiting room that had become something else for a few hours and was slowly becoming a waiting room again. He walked back to his patients without another word about liability. Tessa was near the supply corridor when Julian found her. She was restocking the trauma kit by inventory habit, keeping her hands occupied because her hands were easier to manage than her thoughts right now. Julian came around the corner without hurrying and stood where she could see him. He said he'd been looking for her for a while. Not officially, just looking. He said it without apology or drama, the way someone stated a fact they'd already made peace with. Tessa said she hadn't made it particularly easy. He said no, she hadn't. There was a stretch of quiet between them that held the weight of 3 years and didn't try to resolve it all at once. Julian reached into the inside pocket of his jacket and took out a folded sheet of paper, a printed transcript, the kind generated from radio communication logs, formatting she recognized from dozens of mission debriefs. He said it was the final communication log from the Syria extraction, the unredacted version which had taken him a long time to access and longer still to decide what to do with. He said carrying something that belonged to someone else wasn't his right, regardless of how hard she'd made herself to find. Tessa unfolded it and read it in the light from the supply room window. The log was exactly what it should have been: timestamps, call signs, frequency channels, the mechanical record of a mission in its final minutes. She found her own call sign in the transcript: Shepard authorizing the primary extraction, first helicopter out with the critical patient, and 2 ambulatory wounded Nolan Pierce held at site for secondary lift. All of it was exactly as she remembered it, the same architecture of decision she had rebuilt and examined and prosecuted herself over for 3 years. Then she reached the final entry. It was time-stamped 18 minutes after the primary extraction. Nolan's call sign: 1 transmission, no response requested, no coordinates given, no distress signal attached. Just the call sign he used for her. 1 word sent into a radio channel that he knew she wasn't monitoring anymore because she was already 20 miles away managing her casualties, which was exactly where she was supposed to be. The word was Shepard. She read it twice. Then she stood very still and let herself understand what she was actually looking at. For 3 years, she had constructed a version of Nolan Pierce's final minutes that fit the shape of her guilt. In her version, he had waited. In her version, he had hoped. In her version, the last thing he did was reach for something that didn't come. It was the version that made her responsible in a way that couldn't be undone, and she had carried it faithfully because it felt like the least she could do for a man who had died while she flew in the other direction. But Nolan Pierce had been a pararescueman for 11 years. He understood extraction math better than almost anyone alive. He had told her to take the others and go because he had already run the numbers and reached the same conclusion she had, and he had agreed with it. The final transmission wasn't a call for rescue. It wasn't a reproach. It wasn't a man waiting for someone who didn't come. It was something much simpler and much harder to absorb: a person in his last recorded communication, saying the name of the one he trusted most. Not because she had failed him, because she hadn't, and he knew it, and he wanted her to know it too, even if he understood she might not receive the message for a very long time. Tessa folded the paper along its original creases. She had spent 3 years believing that her penance was the disappearing. The float shifts, the forgettable postings, the refusal to be the person who made the calls again. She had framed it as humility and called it survival. But penance and grief were not the same thing, and she saw now clearly and without the protection of distance that what she had been doing was not mourning Nolan Pierce. It was punishing herself on his behalf with a conviction she had assigned to him that he had never actually held. He had not asked for that. The last thing he had sent into the air was her name used as it had always been used between them, as shorthand for competence, for trust, for someone who would make the right call when the right call was the hardest one available. She had made the right call. She had simply been unable to forgive herself for it. Julian said what he'd come to say. He told her there were options, not a return to active duty, nothing that required her to put the uniform back on if she didn't want to, but roles that needed exactly the kind of training and judgment she demonstrated today. He said she didn't have to disappear to be safe, and she didn't have to go back to who she was before in order to use what she knew. Tessa looked at the transcript in her hands. Then she looked at the room beyond the supply corridor. The triage lanes still marked, the color tape still on the wall. The waiting room that had held more than it was built for and held it anyway. She thought about Sienna Carter asking if it hurt, and about the way that question had landed somewhere unguarded. She thought about Walter Keene's hands, the fingertips going blue, and the chill of knowing she had been right and had no power to act on it until everything else forced the issue. She told Julian she wasn't going back to the unit. She wasn't taking a consulting role or a liaison position or any arrangement that moved her out of a clinical setting. She said she was staying at St. Catherine's. Not because she had nowhere else to go, she understood now that she had options, and that understanding was newer than it looked. She was staying because this clinic was underfunded and understaffed, and located in a neighborhood that had been failed by systems larger than itself, and because she had spent 4 months here being deliberately useless in a place that needed people to be useful. She said she was done with that. Julian reached into his jacket and took out a small metal pin, the pararescue badge worn and unpolished, the kind that came from a uniform rather than a display case. She recognized it without needing to look closely. She took it and turned it over. On the back, barely visible, was the motto she'd had memorized since her first week of training, that others may live. She closed her hand around it and put it in her pocket alongside the folded transcript. Julian left without asking for anything more. Tessa walked back through the clinic. She came to Denning's open door and stopped in the frame. He was at his desk. Walter Keene's chart was open in front of him, the paper chart with her handwritten notes from early that morning. The sepsis alert she had entered at 8:47 flagged and clinically specific, the one he had reviewed and dismissed in under 30 seconds. She watched him read it now slowly, in the way a person read something when they were not looking for a reason to set it down. His phone was beside the chart he'd just received, the latest update from the ward nurse. Walter's blood pressure was stabilizing. His peripheral circulation was returning. The sepsis protocol initiated late, but not too late, was working. Denning was holding a pen. He drew a single line through the dismissal notation he had written beside her alert. Not an erasure, the original mark was still visible underneath. Just a correction. Small and precise and placed exactly where it needed to be. He didn't look up. She wasn't sure he knew she was there. She didn't announce herself. She walked back to the front of the clinic. In the hours that followed, she continued bringing Denning patient files that needed attention. He read each one. He no longer dismissed her observations before she finished making them. He no longer reached for the authority of his tenure as a way to end a conversation. It wasn't transformation one day didn't make a different man of anyone. But it was the beginning of something that had been absent for a long time, the willingness to consider that someone else in the room might be seeing something he wasn't. A new patient had just come through the door, a woman in her 30s, holding her arm at an angle that suggested something was wrong with the shoulder, accompanied by a teenager who had the exhausted look of someone who had been managing this situation for longer than just today. Not a blast injury, not a crisis. Just a person who needed medical attention and had come to the nearest place that offered it. Tessa picked up the intake form from the front desk. 4 months ago, she had walked into this building with the specific intention of becoming someone that no one would remember. She had been efficient at it. She had built the invisibility carefully and maintained it and told herself it was what she needed, and for a while she had been unable to tell the difference between needing something and simply having it. The float shifts, the forgettable postings, the practiced disappearing. She had called it survival and meant it, and in the particular arithmetic of grief she hadn't been entirely wrong. But Nolan Pierce had spent his last transmission saying her name not as a cry for help, not as an accusation, but as a statement of faith. And you couldn't spend the rest of your life hiding from a person who believed in you that completely. She crossed the waiting room, introduced herself to the woman by name, and asked what had happened. She was not invisible. She was not hiding. She was a nurse in a clinic in South Side Chicago, holding an intake form, standing in a room that still faintly smelled of smoke and hemostatic gauze, and the particular exhaustion of a building that had held more than it was built for and held it anyway. She was exactly where she was supposed to be. Tessa spent 3 years believing that disappearing was the same thing as healing. It wasn't. And maybe you've been carrying something similar, a decision you made, a moment you can't stop replaying, a version of yourself you've been trying to outrun. The truth that this story keeps returning to is a simple one: you don't heal by erasing who you were. You heal when you stop using the past as a reason to make yourself smaller than you actually are. If this story stayed with you, subscribe so the next one finds you. Every week, real stories about real people choosing under real pressure to show up anyway. That's what this channel is built for. We'll see you in the next one.